I'm in our district office, Luke, and I think the building engineer, it's not expecting 80 degrees
That's right.
in April or whatever.
Nobody does in April in Michigan, right?
Yeah. So it's tropical in here.
Certainly is. And Luke, where are you? You're joining us from Ann Arbor, correct?
I'm in Ann Arbor. We actually we just added a new bedroom into our house, and so now this is actually my first from what's going to become like our home Zoom studio, I think. So we have a new desk in here, and there's less of a chance that someone under the age of 8 or a four-legged creature will come in and interrupt us in the next half hour. So
that's the whole fun.
That's right. We could arrange that too.
In the Zoom meetings.
Yeah.
I have several of those myself, but not today. I'm in the tropical office. As well.
In the tropical office.
All right, folks, we are just giving everyone a chance. Thanks to those of you who have joined us so far. We're just giving folks a chance to see the live video has begun and to join us. I'm here with Congressman Andy Levin and Dr. Luke Shaefer, and we're going to talk about the impacts on poverty in the American Rescue Plan. And I'm Jenny Beyer with Congressman Andy Levin.
Well, so Luke, while we wait, I'll look forward to working with you on unemployment issues whenever.
Yeah, great. Well, and that's great to know that you know her. So yeah, I'm just going to get all my facts straight, and then we'll be back in touch and
great.
Figure out the right way to approach things.
So important. Very happy to help any way I can.
All right, we've got several folks on the line now. Let's get started. I am Jenny Beyer, the Communications Director for Congressman Andy Levin here in our Warren office in Michigan. And we're so excited to be joined today by Dr. Luke Shaefer, the Director of the Center for Poverty Solutions at University of Michigan. And we're talking about the American Rescue Plan, which Andy and his colleagues voted to pass last month, and the incredible impacts it's having on poverty across the nation, but especially here in Michigan. So I'm going to kick it over to Andy to tell us about this bill. And I want to let you know too that you can post your questions you might have about benefits you could access, how to get those in the comments, and we'll be answering them live on the air. And we've got staff standing by to help us get all those answers too. So give us your best shot. All right, Andy, go ahead.
Thanks, Jenny. And I want to thank everybody for joining Dr. Shaefer me today to talk about the crisis of poverty that's threatening our communities and how the American Rescue Plan, which is the COVID relief bill that we passed last month, addresses poverty with really bold measures that organizers and policymakers have been championing for years and even decades. With millions of $1,400 stimulus checks hitting bank accounts, many folks are already feeling the effects of the American Rescue Plan. Remember, that's not $1,400 per family, but $1,400 for each and every poor, working, and middle-class individual, including kids. But the ARP is so much more than a package of one-time direct relief, just a check. It represents both an ideological and a structural shift in how we address inequality and poverty as a nation. For decades, Washington subscribed to a trickle-down theory of economics that led to the greatest income and wealth inequality in a century. It led to the outsourcing of millions of good-paying jobs and to the creation of an out-of-touch corporate billionaire class with preferences for fossil fuels that is hurtling our planet towards climate destruction. The American Rescue Plan is a direct rejoinder to trickle-down theory. With this bill, President Joe Biden and Congress are demonstrating that the best way to overcome the COVID-19 pandemic and build the equitable economy we need to thrive in the 21st century is to provide working families with resources they need to flourish. I fought for these big changes because we face big problems in Michigan and around the country. When we passed the American Rescue Plan, almost 700,000 people in our state reported that they don't have enough food to eat on a regular basis. Nearly half of those are adults living with kids. A quarter of renters here said they were behind on rent, and almost a third of Michiganders say they're having difficulty keeping up with their bills. With the American Rescue Plan, we're reimagining how child tax credit should work so that instead of getting one check a year, you're getting hundreds of dollars monthly in assistance to put food on the table for yourself and your kids. We're investing in our state and local governments so that everyone has access to high quality public services, and to put well over 1 million public sector workers across the country back to work, people who were furloughed or lost their jobs during the early days of the pandemic. In Michigan, the American Rescue Plan will provide over $14 billion to our state government, our county governments, our local governments, down to every city, township, and village, and our public schools. The ARP also doubles down on the programs that have benefited families for decades. We expanded the earned income tax credit by nearly $1,000 and made it easier for people to claim it. We've channeled resources into the Affordable Care Act marketplace so that most people will be able to afford a plan for $10 a month or less after using their tax credits. Basically, even as we summarize this huge package as shots in arms, money in pockets, children in schools, and people in jobs, each of which is a big deal with multiple parts, our whole approach has been to center Black, Indigenous, and people of color, and to take a bottom-up approach to reviving the economy. I'm really excited to discuss these issues with Dr. Shaefer and hear his perspective, particularly about poverty in Michigan and what we can do about it, what we must do about it. Dr. Luke Shaefer is director of the Poverty Solutions Center at the University of Michigan and a professor of, well, basically everything there, including social work, public policy, and law. You can address questions about the American Rescue Plan and poverty in Michigan to Dr. Shaefer and me in the comments or chat. And we also have legislative and casework staff standing by to help answer questions that may be more technical in nature, especially about how to access benefits. So before we go to questions though, I'd really like to ask you, Luke, tell us about how you see the American Rescue Plan in terms of addressing poverty, addressing child poverty here in Michigan.
Thank you, Congressman Levin. And I'm really glad to be here. I've been a big fan of yours for a long time for the work that you've done for Michigan, both before you were in Congress. And if it were possible to become an even bigger fan, it's because of the ARP. I just really admire and appreciate your work and the work of everyone in Congress and President Biden in passing what really, when we look at poverty, is truly a transformational package. I'm someone who's been studying poverty for decades now. And, from that vantage point, just as you said, I am used to a space of scarcity, right? A space of like never having enough to meet the need that's out there. And I can say definitively in my lifetime, and I really think ever in the history of the country, this is the most transformational package. It changes both the amount of resources available for families who are struggling, and it really does change the way that we deliver those resources. You mentioned the stimulus checks, right? And this has been an incredibly effective and popular program. One of the big changes in the ARP version of stimulus checks is that it counted children as equal to adults. So the first rounds last year always said less for children. And children are expensive, and families with kids are in a triple bind. And so I really respect that they were counted as equal. A group key to my heart are college students, right? And dependents that are over 17, but still dependent on their parents. It included them as well. And they're having a really tough time right now, and that matters a great deal. and elderly dependents as well. So it took a more comprehensive approach than we've had before. And as you mentioned, many of the checks have already been received. At Poverty Solutions, which is the university-wide initiative that I run at the University of Michigan, we've created a website that I'm going to share with your team, and that we could even put into the chat today, that tries to answer everybody's questions. If you haven't gotten your check, if you're waiting for your check, if you have questions, if you're eligible. The most amazing thing about those stimulus payments was that they included people who had earnings of zero, right? That's just not something that we've done before. And it mattered a great deal to me as someone who studied poverty, extreme poverty in the United States. But that's really, as you said, just the tip of the iceberg. The ARP extended the pandemic EBT program, which is a way that we've gotten extra food assistance dollars to families with kids, especially over the coming summer months, which we know can be a really big deal. It increased everybody's food assistance dollars by 15%, and that's going to go through next September. And I was actually working with some data with this amazing group called Fresh EBT that serves over 5 million SNAP recipients. And we could actually see in the data this of millions of observations, when that 15% came in, before you could see actually the spending, people had more money at the end of the month than they had had before. So we could see in real time the difference that made, and that extra 15% is going to continue to make a big difference. With utilities, this is another thing. So there's added energy dollars in two ways. One is a program that's going to be administered in Michigan by nonprofits that helps people who are behind on their rent and on their utilities. And I've got information on how to apply for that. There's an online portal for that program that's administered by MISHDA at the state that people can take a look at and find the community provider. We're talking $21 billion for rental assistance, another $4 billion for energy assistance through the LIHEAP program. And in my role as a special counselor to the Director of Health and Human Services at the state of Michigan, I've already been in 3 or 4 conversations this week with energy providers from across the state and with the Michigan Public Service Commission to figure out how do we use that money in the best possible way to put Michiganders on the best foot forward going forward. In the meantime, you have these 2 routes, right? This rental assistance program that doesn't just help with rental assistance, but also is going to help with utilities and even internet connection for families that need that to have their kids be going to school. And through the My Bridges program at the Department of Health and Human Services for the state, that we've really done a lot of work on to try to make that program, that portal be easier to use. There's going to be a program of $10 billion nationally for homeowners who are struggling. So it's not just folks who are renters. There's money in there for homelessness assistance for folks who are struggling with no home whatsoever. Of course, you alluded to what is my absolute favorite part of this package. That's the expanded child tax credit. And that's something that I've been working on for a long time. And it was just elated to see a year of funding in there. And it has some complications in terms of trying to sort of understand the mechanics, but when you really boil down to it, it is what you said. It's changing the benefits such that families, not poor and middle-class families, all have a stable source of income starting hopefully this summer, right? We want to make sure the IRS implements it on time on a monthly basis for the rest of the year, and then hopefully maybe going forward. It mirrors what a lot of other countries have done called a child allowance. And the child allowance says raising kids is expensive, and the government has a reason to help parents in that work. And sometimes money can help, right? Parents often know the things that their kids need the most, whether it's, keeping the lights on for 1 more month or paying for childcare. So this is going to be a program which is effectively going to create a benefit for low and moderate income families of $250 per child and $300 per young child. And the 2 things I love about it are the huge poverty reduction effects. So in the state of Michigan, this program alone is going to reduce child poverty by 45%. And if that's not transformational, I don't know what is. That's basically going to leapfrog all the child poverty reductions that we've ever done before. But even more importantly to me, it treats very low income families, in fact, the lowest income families, And middle income families, the same. And in the United States, we have a history of saying, here are programs for families without a lot of money, and here are programs for families who are still struggling to make ends meet, but are maybe middle income. And this program says, we care about all kids, and we want to help all parents until the very highest income levels when we think you're doing okay. And that's really a meaningful change to me. It's going to have a huge impact, not just in our cities in Michigan, but across rural parts of the state as well. And it's a benefit, unlike a lot of our other sort of welfare benefits. Those benefits often decline as earnings go up. And the nice thing about this benefit is it's a stable source of income. It's going to stay the exact same amount, and you can go to work and you can still keep that benefit. It's going to stay there. So it's something that you can count on. So I think this is just going to be an incredible change. And there's lots of research that finds when you increase the amount of resources that a family who's struggling have, it does incredible things for them. Kids are more likely to be able to concentrate in school. They're less likely to get engaged in criminal, with the criminal justice system. In Canada, when they increased a benefit like this, you saw alcohol and tobacco consumption go down because families, it had relieved stress for them. And so those types of things are often a response to stress. So you add in the expansion of the earned income tax credit, which is also going to raise the benefits of work, especially for folks without children. And you really start to see, I think, a safety net that provides a foundation for families to build on. And combining that funding for state and local government. One thing I really want to push local governments to do is try to use this significant amount of resources that are going to be put into the system, $350 billion, in order to really improve and enhance communities nationwide going forward. So it's really exciting, and I'm really thrilled to be here to talk with you about it today.
So that's so great. In terms of the child tax credit, you talked about a couple aspects. I wanted to ask you a question about each one. In terms of the kind of universality or the, covering people more broadly, isn't it true historically that that the programs we've done that for are the ones that have gotten sort of durable public support to become features of American life that have made our country better, as opposed to things that are very controversial and come and go and get all politicized?
You're 100% right. If you ask me what the most successful anti-poverty program we've ever had is, I would say hands down so far it's Social Security. It's a program that 99% of Americans are enveloped into. And when you look at food insecurity rates among seniors, they exist, right? And we want to take care of them, but the numbers are just so much smaller. The groups that have the highest food insecurity or the highest trouble paying their rent are families with kids. So this really tries to mirror that and say, we're going to bring everyone into the same program, and we're going to stop doing this thing where we divide families into poor and middle class. And I think that division can create animosity. And when I look at this program versus what we've done for decades, I just think, like, how did we do it that way for so long?
Yeah. All right. Well, Jenny, let's get to questions. I'll just say that I think you noted, Luke, that we've got to make this permanent. I mean, this is just 1 year in terms of that child tax credit. So we'll, that's work to do next. But go ahead, Jenny. I bet there are
right.
folks who want to get in the conversation.
Absolutely. We have some great questions. And I just want to remind all of our listeners, if you have specific questions about the American Rescue Plan and how to access these benefits, we understand it's a complicated bill, and we are here to help you make sense of it. So please put your questions in the comments. I did also put our coronavirus resources page in the comments, which has a frequently asked questions document about stimulus payments. And Dr. Shaefer, we would love to include your center's page as well. The more resources, the better. And we're always happy to help you in our office with your stimulus checks too. So we got a question from Steve Gold. He has asked us what sort of resources there are for public health in the American Rescue Plan, since that has been so underfunded and has a great impact on our most vulnerable citizens.
Well, I'll just say that I mean the ARP was really the largest expansion of health coverage in more than a decade. Millions of Americans are going to gain coverage. They'll see their monthly insurance premiums go down. That includes both people who didn't have coverage will get it cheaper than they would have, and people who already have coverage can literally, am I wrong, Luke, go back in the system, reapply, and get cheaper coverage. So that's
right.
amazing. We have expansions for Medicaid, for states to increase their Medicaid programs. And also in terms of the public health aspect of it, I mean, we've got $20 billion in here to enhance vaccinations and contact testing and contact tracing programs. Steve, we're literally some of the things you're seeing happening are getting the most attention, like FEMA at Ford Field, for example, to help everybody in Southeast Michigan, are funded by the ARP. So I don't know, Luke, if you have other things or different things to add to answer Steve's important question.
Those are the things I would have pointed to. So these expansions of health insurance, and the other really important thing is that we stopped asking people to recertify who are on Medicaid. So a lot of people, one of the problems we've had with that is that people cycle on and off with those. And so people have had stable coverage this whole time. With the public health dollars, that is a great question, Steve, that there are additional resources, just as the congressman said. And I think it's a great thing to connect with your public health authority and try to figure out how are those resources being used, right? And be a part in your community of figuring out what can we do with these resources. Again, from going from a place of a relative scarcity to a place of more abundance in the resources. Finding out like what is your community going to do with the funds, the state and local funds. I've seen really interesting ideas about de-letting in communities with some of those state and local funds as well. So I think that's really something to explore to see exactly how those funds are going to be used.
That's a great point. Okay, Jenny, what else you got?
All right. We had a question from Andrew about what we're going to do about some Trump appointees that might still be in place that could perhaps have an impact on our most vulnerable citizens, thinking of DeJoy at the post office, Social Security, and so forth. Congressman, do you have an answer for that?
Well, on my end, I would say that our oversight is key. We've got to call these folks in, write them, give them very pointed questions, have them come in and answer them live before the American people. And, ultimately, the president may have a way to, get new people in there, either because of folks' terms expiring or, for other reasons. Each appointee depends on the nature of their position. So, for example, Postmaster DeJoy is hired actually by the board of the U.S. Postal Service, not directly by the president. But the president appoints those board members, and he's got some vacancies to fill there. So there's a lot we can do, Andrew, I think, both in terms of oversight and, ultimately replacing folks.
All right, our friend Amanda had a question for us about workforce dollars. She said it seems like the bulk of those are coming through the American Jobs Plan, but if there's anything you can think of in the American Rescue Plan that could perhaps be used as a creative solution for workforce. And I wanted to give you a moment, Congressman, to talk about the letter that you led to make an investment in workforce development and how that was included in Biden's American Jobs Plan.
Well, okay, for sure. I mean, so I guess I should say to folks that in case they don't know, I'm on two committees, the Foreign Affairs Committee, but also the Education and Labor Committee, and very active on this issue of job training, help for people with disabilities, help for people with various barriers to employment, returning citizens, people with numeracy and literacy issues, and so forth. And I led a letter to the president actually asking for $50 billion for workforce. And I'm really thrilled that the president is making that investment through the American Jobs plan. So we're working on details as we speak, but I think that what Secretary Yellen, other secretaries have said to us, and the president himself, is they're really the American Rescue Plan was a crisis, and we had to get it done fast. They're looking more with the jobs plan to work together to put the components together. So I'll be in there pushing for maximum dollars and details really for workforce programs. But I'd love to hear from Professor Shaefer about this, because he's a real expert on it. We've talked over the years about this and its impact on poor Michiganders in particular.
Yeah, the one thing I'll add in ARP is that there is an allowable expense for these local dollars to go to subsidized jobs programs. So we're going to be writing on that. And subsidized jobs programs are programs either administered by a public agency, a government agency, or administered, facilitated through private partners to provide jobs for folks who are struggling to find one in the private sector. And they have a lot of success in sort of providing a bridge into the labor market. And the cool thing is you can use them for community betterment. So we have some resources at poverty.umich.edu about how municipalities could do a subsidized job program like this. And we're going to be doing more about what that would look like with ARP funds, if that's something that's attractive.
That's so helpful. Thank you so much. Excited to learn more about that. All right, we have a question from Lisa, who wants to know if there will be an increase in Social Security. And Congressman, I wanted to give you a chance to talk about your support for this idea. And Dr. Shaefer, then if you'd like to tell us how that could impact our seniors here in Michigan.
Well, let me say two things about it and get Luke to respond, especially to the second one. So Lisa, I'm a big supporter of a raise in Social Security allowances, and I'm an original co-sponsor of the Social Security 2100 Act. It's named that because it would, to oversimplify slightly, take the cap off Social Security contributions, so rich people would pay their fair share of making Social Security for everyone, and it would make Social Security solvent past the year 2100. That's why it's called that. And I even had John Larson, the author of the bill, come to the district for a town hall before COVID. That was in the last Congress. But what about this too, Professor Shaefer? Americans' pensions have largely gone away. I mean, working people used to have defined benefit pensions, and not many do anymore. I'd love to see a Social Security Plus program where we'd create the ability of all employers to pay in to match worker contributions. So you could have essentially a pension that's not dependent on what job you have. It could travel with you. You could build it your whole life, just like a carpenter or a plumber does with a great union, through the building trades. But for the bulk of Americans who don't have access to anything like that, I'd like to see that. Now, Wall Street probably wouldn't like it because, the government would run this thing and it would have very low costs for workers and much to their advantage. But anyway, happy to hear your comments on any or all of that, Luke.
Yeah, I'm also in favor of expanding the tax base with Social Security. So it caps off pretty it could go a lot higher. And I often think of that as sort of the wealthy person's tax cut about halfway through the year. And that's an obvious way to deal with sort of the financial challenges of that program, which are, exist, but are not massively detrimental. I would also be, as someone who is a little bit closer to the work I do, thinking about SSI, supplemental security income, and SSDI. I think those are rates that we should look at. And in the federal government, we spend a lot of time arguing over inflation adjusters, and I'm a big fan of looking at sort of the core stable expenses. If you look at something like housing, that has just significantly outpaced the overall inflation increase in inflation, housing is just far more expensive. And when you're living on a fixed income, that's just eating up more and more. And so I think those are things that we could look at very closely. And I haven't studied it, but I do like the idea of sort of if we have that base of stable support in a program like Social Security that has such a huge poverty, anti-poverty effect, sort of building on things on top of that. You see, some of our estimates are that something like 20 to 30% of the workforce are in totally non-traditional jobs, right? Where, and then the folks that are in traditional jobs are much less likely to have pensions. And so creating packages that people can take with them might make us more nimble, right? If we're thinking about people who might want to start businesses too, but they're worried about giving up all of that. And we should probably, Congressman, sort of throw unemployment insurance into that mix too and figure out how do we make that program work better. We fixed it temporarily during the crisis with the expansion to previously ineligible folks, but it is a program that is sort of based on a very traditional sense of employment. Yes. And as you say, as people are going in a much different direction, we probably need to figure out different structures.
100%.
All right, we are at the 3:30 mark. We do have a few more questions that we will try to get to. Dr. Shaefer, if we
I'm happy to stay on for till 3:40.
Wonderful. We're going to aim to answer a couple more in the next 10 minutes. But if we don't get to your questions today, I really want to encourage you to reach out to our office. And we're working remotely right now, but you'll leave a message and we'll give you a call back very soon and try to get answers for you. So our next question is from Tracy about when we think we could pass the Raise the Wage Act, which would raise the federal minimum wage to $15 an hour. Congressman?
Boy, Tracy, that's a question that's very important to me. I went to the White House a couple weeks ago now, Jenny, I think it was, and met with the president, chief of staff, and other lieutenants. And our number one issue was to press them on the fact that, okay, if this didn't meet the Senate's rules to get in the reconciliation package, I didn't run for office to give speeches about $15 an hour. I ran for office to deliver $15 an hour to the American working people, including no sub minimums for tip, workers and others. And so I am actually, what I can say is this: I don't know when, but I'm really hopeful. I feel confident that we have a partner in Joe Biden and Kamala Harris and their team that is very determined to get this done, that sees a number of ways that we could get it done. But the first thing that we've got to do, Lisa, I would say is, Tracy asked this question, right, Jenny? So Tracy, we got to find those senators who might be a little iffy on the Democratic side and press them to be shore them up, to be sure that they're for the full $15 an hour, because we need 50 votes no matter what mechanism we use. So that's, I want everybody to push very hard in that direction. There's no question. The best thing of all is, I think Joe Biden's been studying Franklin Delano Roosevelt. He understands that having people, an active citizenry, nonprofit groups, unions, poor people's groups, pushing them to do the right thing is actually helpful to them. And I've been really impressed that they want to encourage citizen activism around these issues. So we got to get it done. We just have to tackle poverty in this country. Work's got to.
That's so great. So Dr. Shaefer, if we have listeners today who have friends and family in states with a Republican senator where they could call them and say, please support this, as the expert, what would you suggest they say about why it's important to raise the minimum wage?
Well, I think the strongest argument is that everybody thinks we should do it. It's amazing when you think about, I've studied the minimum wage for a long time, and, I am sort of deeper into the research. So, I do sometimes think about different variation across cost of living, but everywhere it's on the ballot, it passes overwhelmingly. I just think about Florida, right, where that voted for the outgoing president in the last election and voted for the $15 minimum wage, right? So I think just stressing that the American people want this. This is firmly within American values to say that an honest day's work should get an honest day's pay. And if you're not for it, there are things, we talk a lot about being divided in this country, but if you look at a core set of issues, you ask people, should we raise the minimum wage? 70%, pretty much on any survey or any ballot measure, will say yes, even in the most conservative states. And there's a very vocal small group that will say no, and they have too much power. So I think just stressing, like, you call and you get your friends to call, right? And you let them know that, like, this is about values. That's what I would say.
Wonderful answer. Thank you. All right. For our last question today, Mark asked if, Congressman, have you had any luck getting more Republican support for President Biden's initiatives?
Well, that's really an interesting question. So, I mean, in terms of what we've done so far, the president met with 10 Republican senators who said they had ideas about what he should do with the American Rescue Plan. And they said, no, don't spend $1.9 trillion, spend $600 billion. And they didn't really have substantive different proposals. They just said it's too much money. And he said, well, thanks very much, but this is an emergency. And everybody knows I'm so bipartisan for 40 years. Right now, we've got to do what we've got to do. And with incredible discipline, and, for sure, Mark, 0 Republican votes, we moved the American Rescue Plan through the House and the Senate and got it done, got it to his desk. And we don't have any votes to spare, obviously, in the Senate, and very few in the House. Now, going forward, we are really hoping to have some bipartisanship. Infrastructure has traditionally been bipartisan. Fixing roads, bridges, and sewers. Today, I don't see how you can say broadband isn't part of infrastructure. I don't see how you can say, well, like EV charging stations, one of my causes, isn't part of infrastructure. So, I think that we're going to fight for as much bipartisanship as we can get. But I think bottom line is we've got to do the business of the American people. And my value is to fight for justice and fight for progress. And wherever it can be bipartisan, that's great. I'll say finally on this, Mark, that as I mentioned earlier, I'm on the Foreign Affairs Committee as well as the Education Labor Committee. We get a lot of bipartisanship on the Foreign Affairs Committee. So, that it's wonderful. I'm pushing for more bipartisanship on our shores, as well.
Thank you so much, Congressman. All right, Dr. Shaefer, it was so helpful to have you here today. I'm going to go ahead and post in the comments some links about the resources you talked about with the Poverty Solution Center, but do you have any final thoughts for us as we wrap up today?
Yeah, I just want to encourage people, especially if you know families with kids who are struggling with childcare costs or struggling with the rent, just make sure that they know about this expanded child tax credit. And when you mentioned bipartisanship, it was a fascinating moment during the debates when Senator Mitt Romney came out with his own child benefit proposal at the same time. So you had a Democratic president and a Republican senator sort of debating the best way to reduce child poverty, right? And that's really where I come in. Like, I'm ready to work with anyone. But what we did in ARP, let's be clear, is, has the most transformational impact of anything that we've ever done. So if you think that reducing child poverty by 45% is something we should do as a country, then join me in thanking the leadership in Congress and encourage them to make it permanent. And then let's work as communities to figure out across the board, if these resources are coming in to every state and they're coming into every municipality, I think there's a ton of bipartisan work to be done of saying, like, how do we utilize this the best to make this a transformational moment for our society, right? And really put us on a different track, a different place going forward. And so get in the game and reach out to us at Poverty Solutions if we can be helpful. And I'm really appreciative to you and Congressman Levin for having me today.
Thank you so much, and for your help to our office in unpacking all of this as well. Congressman, do you have any final thoughts to share, and could you let folks know how to get in touch with us?
Yeah, for sure. Well, first I want to thank Luke Shaefer, who's been a partner in figuring out how to reduce poverty for years, and he's just such a champion. I'm, as a sort of patriotic Michigander, I'm so glad you're leading these efforts in our state. I just want to say a couple of things. First, let me give the contact information because we do want to hear from you whenever you have a problem of any kind. Don't worry if you're thinking, oh, is it federal, is it state? Just call us. Leave us a message. We get back to you within a couple business hours. No, push 1 for this, push 2 for that. Just leave us a message. Don't worry about it. Make sure you leave your phone number and we will call you back. The number is 586-498-7122. That's 586-498-7122. And the website is andylevin.house.gov. andylevin, my name.house.gov. And you can find us on socials at Rep. Andy Levin. So that's how you stay in touch. 2 thoughts. Number 1, just as a dad, as a human, we bring children into this world. No child should be poor in the richest country in the world. This is a huge step we've taken. We've got to make it permanent. We've got to study it. I'm confident Professor Shaefer will study the heck out of it and unflinchingly tell us what we did right and what we did wrong and what we need to do differently. And so we're starting down a road at making a more just society, and we've got to keep going. And then Jenny, I have to close with the very practical. The news flashed across while we're live on this that we had over 8,000 new COVID cases. Friends, I want to encourage everyone to get a vaccine, but we're in the danger zone. The end zone is after we got enough people vaccinated and enough people with immunity. We are not there today. It's in sight. We have the means, we have the money. We're expanding all of the vaccination sites. But in this moment, until we get there, whether it's weeks or months from now, everybody please wear your masks, wear a double mask, maintain social distance, wash your hands, don't go in large crowds. Let's all take care of each other right to the end so we can get this dang pandemic behind us, because we are in the danger zone still in Michigan. And I want to see us get to the other side of it. Jenny, thanks for doing such a great job putting this together, and thanks everybody who watched us. And
Thank you so much. I've put the contact information that you mentioned in the comments as well, so folks can find it there. And thank you all for joining us. Please stay safe.
Thanks, everybody.
Right.
Thanks, Professor.